Hey guys, it's Radhika here again. Hope you're doing well. Okay, so in today's video, we're actually going to change a few things up. So we just finished talking about med school prep, the undergraduate studies part, and today we're going to start talking about extracurriculars. So I'm going to essentially break this down into about two videos. In this video today, I'll be talking about the types of extracurricular activities that you can get involved in. And the video after this, what we'll do is we'll leave you with some advice about how to go about selecting the types of extracurriculars that you want to be involved in. Okay, so let's get started. All right, so firstly, what are extracurricular activities? And I get this question as an instructor quite a lot because people don't really understand, a lot of students don't really understand how broad this field or how broad this title actually is. So extracurricular activities are any sort of activity that fall outside the realm of your regular university curriculum. So anything that's outside of the curriculum that you're participating in, that you're giving time towards, is an extracurricular activity. And there's a range of these things, okay? So they include clinical experience, research experience, volunteering or any kind of community service, teaching as well. So any teaching that you do as a TA, that you do even outside of school, tutoring, maybe you teach piano, any paid employment, any sort of work, part-time, full-time, is all an extracurricular activity. Scholarships and awards, they're noted for your behavior, your excellence in something, and that activity that you've engaged in that's led to that scholarship being rewarded to you, or that award being rewarded to you, is an extracurricular activity. So the reason I'm spending time talking about extracurricular activities is because they're super, super important. This is a way for you to diversify your portfolio, okay? So when medical schools see applications, they see that everyone has this amazing GPA, this great MCAT score, and that's all great. But how do they really figure out the uniqueness that you as an individual offer? Like, what sets you apart from everyone else? And to do this, they kind of look at what you've been involved in the last X number of years. So they take into consideration the nature and the depth of the extracurricular activities that you've been involved in. And I want you guys to know that it is a significant factor in your admissibility to medical school. So back in the day, medical schools weren't interested in this. They chose to incentivize the people that had the best GPAs, that had the highest GPAs, that had the highest MCAT scores. And you know what they found? They found that all these people went through they got into medical school, the ones with the highest academic scores. They went through medical school, and then when it came to them being licensed practicing physicians, we started realizing that they didn't really have the kind of people skills that were necessary in a field as sensitive as this. And since then, they've learned that we need to look at students who not only have the academic finesse to kind of succeed as future physicians, but also people who are amazing at communicating with patients. So what's a way then, if they've realized this, that for them to determine who has these great interpersonal skills? Well, it's by looking at your extracurricular activities, okay? So they are really looking to see that you've taken part in activities where you've demonstrated leadership skills, skills that you would not be able to hone in on or practice through going through school, but you would have if you were volunteering somewhere, or if you were teaching, or if you were working in a hospital somewhere, shadowing someone. Okay, so I'm actually going to talk about these activities and what they mean. All right, let's get started. The first one I want to talk to you about is clinical experience. So clinical experience is truly important for you. It's tough to say that you want to be a doctor when you've had no exposure to the way that a hospital works or the way that a clinic works. So what you having some sort of clinical experience kind of shows the schools is that you really know what this field's going to be like. You kind of know the ins and outs, you know the day-to-day interactions that take place. You have an idea of what a department in a hospital looks like, or a walk-in clinic, something along, you know, the lines of giving you some sort of exposure to the field. Now, I'm not saying that if you don't have clinical experience that you will not get into medical school, but I do want to leave you with a little bit of information about this section specifically. 90% of the students, and this was a study that was conducted recently in North America, and they found that 90% of the students who were admitted to medical school had either volunteered or worked in healthcare prior to that acceptance. So they did have clinical experience. And another thing to kind of give you an idea of how important this factor really is back in the day, medical school admissions interviews used to ask, do you have any clinical experience? And now they don't ask that question. The question they ask now is, please tell us about your clinical experience, or please describe your clinical experience. So it's almost assumed that you have clinical experience. So again, I'm not saying that this is something you have to do, but I do think that it's something that you should give a lot of thought about. It's a very important part of your application. And forget your application. I think if you have clinical experience, you know, you've got this idea of, I want to practice medicine, I want to get into medical school, this is the kind of specialty I'm leaning towards. Well, that's great, but the things that you study in undergraduate studies are nowhere like what medical school and a clinical setting are actually like. So if you really want to be able to say, yes, you know, not only do I want to study these things, but I'm going to thrive in this profession because I love it so much, well, the only way to make sure you know that you love it so much is to actually expose yourself to it. Get right into it, see if it is something you enjoy. So it's not just for the applications. I think there's takeaway for you as an individual as well. Okay, so moving on then, the other thing that you probably also want to do is get involved in a little bit of research. Now, the only time that you have to be involved in research in order to get into medical school is if you're doing the MD PhD program. So that's somebody who is more interested in academics or in a research career. If you're applying to just MD programs, there are no schools that will say that you must absolutely have this kind of a research component, otherwise we will not consider your application. Now, MD PhD program, you got to have research. You have to have at least some experience so that they see that you're cut out to do the PhD portion at the least. Okay, so why is the question? Why do medical schools like applicants who have had research experience? And I'll tell you why. It's because as a physician, you're constantly learning. You're constantly, and on almost a daily basis, educating your patients, your families about their and their families about their conditions, and to stay on top of medicine, because it's an ever-evolving field, it's an ever-changing field, and you know that's one of the beauty of the sciences, that they consistently change. So for you to stay on top of everything as well, you also need to make sure that you're doing your research, you're reading those articles, you're on top of those papers. If you're a neurosurgeon, you're reading neurosurgical sciences, you're reading neurosurgery, you're reading the Canadian Journal of Neurosurgical Sciences to stay on top of techniques that have been introduced, new treatments, new diagnoses, new technology that's been introduced in your field. And that's something that as a physician, you're going to have to continue doing for the rest of your life, staying on top of the most current knowledge, and that requires quite a bit of research. Now, a lot of you may also be physicians who practice, but very heavily involved in research as well. So you want to get a good feel of what research is like now to see if you want to go to a research-based medical school, or even while you're at it, after your 4 years of medical school, if you want to choose a specialty that's more research-based, right? If you're going to be a pathologist, that requires a lot more research than in some cases of being a family practitioner. Okay, so now it doesn't really matter what kind of research you get involved in. It doesn't have to be medical in nature. They want to see that the skills that you have in order to conduct successful research, to conduct ethical research are there, okay? And if you're in your undergraduate years, there's basically 3 ways that you can get involved in research. So the first would be to take a course for a credit that's based in research. Many upper year courses, especially in biochemistry, are lab-based courses. Besides your first year biology and chemistry labs, they're a great way to kind of expose yourself to more upper year or more complicated techniques. So if you're not going to take a course, or if you're not too interested in taking a course, again, because you're considering how that course will affect your GPA, then something else you can do is get involved in a summer research program. So there are great programs. One of them is NCERC, and you can be part of a wonderful research lab. And a lot of students really decide after having taken an NCERC program that they were thinking about med school, but perhaps they enjoyed the research so much that this is a better idea for them. So again, this isn't just for medical school applications, it's for you as an individual as well, because you're really discovering yourself through these activities. And then the last way you can get involved is if you don't want to apply for a formal program during the summer or take a course for credit, talk to some of your professors. Most of them have research labs, and say that you'd like to get involved, you'd like to be exposed to what research is, and ask if you can volunteer in their lab. Okay, so 3 pathways. It's a very important part of your application. Again, I'm not saying you have to have research experience unless you're going down that MD PhD route, but it is a pretty important factor. You'll learn a lot out of it yourself as well. Now, the next one is volunteering/community service. So this is the one that most people commonly think of when they think of extracurricular activities. Volunteering is great for your application. It shows that you are compassionate, you are caring, you're empathetic, and you are giving your personal time towards the community, right? You're essentially being a leader. So you're kind of demonstrating these wonderful leadership skills. And physicians are community leaders at the end of the day. And they want to see that you've been involved in activities where it's not just about you, it's about giving to other people, and doing so in a manner where you're still managing what's going on in your personal life, your academics, your MCAT score, anything going on with friends, family, relationships. And on top of that, that you're so well balanced that you can give to your community. And this is what really makes a well-rounded candidate. And medical schools love seeing this. So the type of volunteering that you actually get involved in doesn't have to be medical in nature. It can be, which is great, because a lot of physicians do get involved in volunteer services after they've completed licensing exams. But it can be completely non-medical or non-clinical as well. You could be working at a soup kitchen. You could be working at a food drive, a women's shelter, just showing that you value your time, but simultaneously, you value those in your community, and you value your community enough to kind of give back to them, okay? Now, next thing then is teaching. Now, nobody ever says, you know, teaching is an extracurricular activity, but it is. And furthermore, it's one that's so crucial to practicing medicine. As a physician, you are a teacher. You may not be directly teaching, you know, residents or interns or fourth-year med students who are going through rotations, but you are always teaching your patients and their families about efficient healthcare, about how to manage their condition, how to live with their symptoms. And as having to explain that is teaching in its essence. So you don't have to become a professor once you're done medical school, or you don't have to teach medicine, but you will always be educating at the least your patients and their loved ones. So this idea of being able to communicate concepts that'll be really difficult is a skill, and it's a skill that's better, or like that always gets better once it's practiced. So if you have the opportunity to teach, whether that is to tutor a student one-on-one or to TA for a class that you really enjoyed, or perhaps to lead some sort of a workshop in your community, that's a great experience. Medical schools will like it. Okay, so work. Now, a lot of students, a lot of you who will be taking the MCAT or have taken the MCAT and are looking to apply to medical school are from science backgrounds. And in the sciences, as a graduate myself, we always downplay how important work is. But medical schools actually value students and applicants who have work experience, especially in customer service, because a lot of medicine is having to deal and manage and cooperate with people from diverse backgrounds. And I'm not talking about just in a sense related to your patients, but you have colleagues, you have coworkers. If you're a surgeon, you have an OR team full of nurses. Perhaps you have another surgeon that you're working with. You are required not only to be able to communicate with these people, but to communicate so effectively while keeping in mind the health of that patient. And work is a great opportunity that exposes you to different kinds of people. You sometimes have people that you are working for, your bosses or higher ups. You have sometimes people who are reporting to you, and essentially you're a manager. And with every interaction you have, what you learn is how to respond and cooperate effectively. And medical school is like that because it's essentially something that you're going to have to be doing for the rest of your career. Now, it's very downplayed in the sciences, undergraduate sciences, I mean. But if you can manage a full workload, a full course load, plus part-time work, plus some time given towards extracurricular activities, and succeed academically at the end of the day, what that shows to medical schools that you apply to is that you are an extremely well-rounded candidate, and they really prize that, okay? Medical school is not easy. We've all heard stories about the number of hours people put into being good students, and it doesn't get easier anywhere throughout those 3 or 4 years. So this is a way to kind of, again, test yourself to see if you're really cut out for the field. Can you take this insane workload with school, with paid employment, with extracurricular and research activities, and still come out on top? Because if you can, that's a great indication that you are going to succeed as a physician, okay? So take pride in your paid employment and really pursue it. Now, what I want to leave you with a word of caution when concerning paid employment, and that's try to choose work which actually allows you to hone in and focus on some of the skills that may be necessary for medical school. So if you're a dishwasher at a nightclub, it may not be as relatable as a job to your future career as a physician as perhaps a customer service representative where you're dealing with people all the time, okay? So you want to approach this very smartly. You're not going to turn down great paid employment opportunities, but at the same time, you want to make sure that you're actually learning skills that you can transfer later on in your career. Okay, so moving on then, scholarships and awards. Now, scholarships and awards are things that you don't actually have to do anything for. They are given to you for your excellent behavior in something. You get them because you're exceptional and other people notice that. And medical schools like that. If you are great at music, if you have an award for music, what that shows, more than the fact that you probably enjoy the instrument that you play, is that there must have been some sort of serious dedication throughout your childhood for you to be able to get that award, okay? And medical schools like dedication. They can see that you followed through with this for many, many years in order to get to the level you are, some sort of exceptional behavior or performance to have received an award. Same thing with scholarships, right? They distinguish excellency, some sort of behavior that's outstanding. And it doesn't have to be medically related at all. It just shows much more. It shows dedication, it shows hard work, it shows persistence, which are all skills you need to be a great medical student as well. Okay. Now, and the last thing. Now, we've talked about a few types of activities. That's not to say that there aren't others. Do you excel in performing arts? What about the fine arts, athletics, and sports? Do you have like a random hobby that most people would not think of? Well, medical schools want applicants. They want candidates with varied interests. Like I said, you know, everyone that applies, or the vast majority of people that apply here, have great scores on their MCAT. They have a stellar GPA. And how do you really send in a few pieces of paper and kind of try to distinguish yourself? It's through extracurricular activities. It's through hobbies. This is where you're adding dimension to your application. You're adding character. So it's almost like a narrative. And this is, through your extracurricular activities, what you're kind of giving to this narrative is the character building portion. And if you have a hobby that's, you know, not normal, or it's not heard of, you make a very, very memorable candidate. You stick out to people who review that application, and it's only a great thing for you and your application. So participate in other activities. Do you like some sort of student governance, Model United Nations to be a part of, some sort of student body, science president? Do you have membership on some sort of an executive club or team? Do you take part in intramural activities? These are all great things. A lot of them show your leadership skills. And again, leadership is extremely crucial for you to, in this future career. And they want to see if there's anything transferable about some of your hobbies and the things you like to do towards your future career as a physician. Okay, so I'm going to leave it off here. In the next video, I'll offer you some advice as to how to pick the activities that you want to be involved in, because obviously you don't have time to do anything. But just kind of to sum up what we talked about today, there are many, many different types of extracurricular activities you can be involved in. I'm not saying you should be involved in all of the things that we've talked about in this video, but really try to pick ones that interest you. And pick ones that you think will be able to equip you with the right kind of skills to excel in medical school and to excel as a doctor. All right, so I'll see you next time. Bye guys, take care.